Hello, everyone, and welcome to another edition of For the Health of It. I'm Lou Beccaria, your host. So glad to have you join us. In a recent show, we've covered the topic of ACEs, adverse childhood experiences, and its mental health effects on children who have experienced various types of psychological trauma. Today, we're going to address the ACEs issue from another angle, that of the physical effects of childhood psychological trauma. We're covering the ACEs issue from these different vantage points because we believe that it's so critical for the average citizen of our area to first, at least be aware that the ACEs issue can exist among children and youth, and secondly, to have you gain a better understanding of the short and the long-term effects of this condition. Our guest to talk with us on this topic is Dr. Nadine Bean, a professor in the Master of Social Work program at Westchester University. Dr. Bean has studied the ACEs issue for a long time and will be sharing with us her expertise. Dr. Bean, welcome to For the Health of It. Thanks for taking time out of your teaching duties to be with us and to educate the Phoenixville public.
I'm glad to do it. Thank you for having me.
Well, first, tell us just a little bit about your own background and how long have you been at Westchester? And I know you're a distinguished professor.
Thank you. I'm just completed my 21st year of teaching at Westchester University.
Wow.
And before that, I did a postdoctoral research fellowship at the University of Maryland School of Social Work on family violence in the military.
Okay.
Before that, my practice experience, clinical experience, was all in the child welfare, public child welfare, and early intervention realms. I did in-home family support services to children and their families who had developmental delays or disabilities, and learned firsthand, even before I knew really what ACEs was, that ACEs was very prevalent.
Mm-hmm. Wow. Well, you bring a lot of background to the issue of ACEs, so thank you for that. So for the general public who are tuning in here, who don't know anything about ACEs, probably, could you give a general overview, Doctor, about what ACEs is?
Yes. Adverse childhood experiences, as you had said, are experiences in childhood that include things like child maltreatment, whether that's psychological, physical, or sexual abuse, witnessing family violence, among your caregivers. Mm-hmm. And more recently, we're realizing that there are other types of ACEs that may be not quite as evident, such as poverty, which is the most insidious type of trauma, if you will. If a child is food insecure, or a household is food insecure. Mm-hmm. And these are traumas, and traumas have cumulative effects on the brain. And we've learned, particularly in the last 20 years, they have lifelong health impacts. Lifelong,
wow. Okay. And how would that demonstrate out at these lifelong effects?
Well, the original ACEs study was conducted in the early 90s by Felitti and Anda, who were from both the CDC and Kaiser Permanente in California. That involved tens of thousands of adults who had chronic health issues, and they began to realize that there was a common theme for those that had health issues, such as heart disease, stroke, cancer even, and a shortened lifespan because of these chronic health diseases. And they began to ask about their childhoods and interviewing them about possible childhood trauma, and found that those with an ACEs score of 3 or 4 or more, they could have a shortened life expectancy by as much as 20 years if they had an ACEs score of 5 or more, and were at much higher risk than the general population for things like cancer, diabetes, heart disease, etc.
Wow. Just for the instructional purpose of our viewers, the score that you're talking about, I think originally there were 10 different
10
aspects
questions.
of violence that were identified, and people had 4 or more, they were considered an ACES child. So that's how you get the score. Right?
Well, they were considered at high risk for chronic health conditions.
Okay. All right. So there's something called toxic stress. And how does that relate, doctor, to the whole ACES issue?
Well, very intricately, and there's not that much difference. Dr. Nadine Burke-Harris, a pediatrician at the Center for Youth Wellness in San Francisco, one of its poorest neighborhoods, one of its most economically deprived neighborhoods, began to realize that instead of screening adults about their past childhood experience, we should start even prenatally with the mother carrying the baby and asking about her childhood experiences, and then continue to screen for ACEs/toxic stress in the child's life at every wellness check. She has now become the Surgeon General of California.
Oh, is that right?
Yes.
Didn't know that.
Yes, and one of my heroines, definitely. And she's right. We shouldn't wait for a retrospective screening in adulthood. We should start much earlier. And she is responsible for new ACEs screening tools that include things like I talked about just a moment ago: poverty, high crime areas, drug trafficking, sex trafficking, and so forth in the neighborhood. And she, as many of us do that work with children and families, realize that there are risk and protective factors at the individual, the family, and community levels.
Right.
And we need to look at all 3 of those levels to really get an understanding of the impact on a child developing brain and body.
Yeah.
And she said that that issues like poverty, living in high crime areas, even high noise areas and dense urban environments, where there's a lot of gun violence, perhaps, that is
Toxic
what she
stress.
calls toxic stress, right?
Yeah.
So ACEs are kind of definitive childhood experiences that have a negative impact on the developing brain and body. Toxic stress is what you live with all the time. And the combination is really serious for lifelong health impact.
Yeah. One of the fascinating things that you just said that I found fascinating was for the pregnant women, okay, while they're carrying the baby,
Yes.
I mean, the baby
It's going to pick up
is going to pick up
the stresses,
on all this.
the stress hormones. Yes.
Stress hormones.
Yes.
Wow. So the physiological effects are just tremendous.
They're tremendous.
Yeah. Okay, we're going to take a break, Doctor, for a commercial. We've been talking with Dr. Nadine Bean about the physical effects of the condition called ACES, Adverse Childhood Experiences. We have a lot more to go over when we come back from commercial. Please stay with us. We'll be right back. Hello, everyone, and welcome back to For the Health of It. For those of you who are just tuning in, we have the pleasure today of talking with Dr. Nadine Bean from the Westchester University, and she teaches in the Master of Social Work program and is a distinguished Lindback Award winner as well, which is a very prestigious award in college teaching. We're talking about the topic of ACEs, Adverse Childhood Experiences, and it's something that you really, really need to know about. So, Doctor, let's start off the second segment with resilience. What is resilience? Why is it so important when someone has been affected by adverse childhood experiences?
Yeah. I'm so glad you asked that, because I think we're remiss if we focus on ACEs and screening for ACEs and don't also focus on resilience and building resilience. In a nutshell, resilience is the ability to survive, perhaps even to thrive, despite adversity, including ACEs and toxic stress. And we're finding that people aren't born with a fixed amount of resilience, but you've probably know, perhaps even yourself, have overcome adversity of various sorts. And I'm fascinated by the survivors and even thrivers. Okay? And
what's the difference, by the way, Doctor? Don't mean to interrupt you, but the difference between surviving and thriving as it relates to resilience?
Yes. Surviving is just a matter of, getting through despite adversity. Thriving is actually perhaps even growing beyond survival and able to then cope with any future life adversity.
Okay.
And we know many people, many famous people who have survived and thrived despite horrible early childhoods. Oprah Winfrey is a prime example. She survived and now thrives, of course, despite terrible childhood maltreatment, including sexual abuse.
Yeah, so it's like building up a reserve tank,
It
so to speak.
It is. And we as health professionals, and I include mental health professionals like me, a licensed clinical social worker, can actually aid and help people build resilience, build positive coping techniques, learn from, and then prevent maybe the cycle of adverse childhood experiences such as child maltreatment.
Right.
And we need to, one of my favorite central values of social work and what I say all the time to my students is first instill hope. So if a person comes into your practice and you discover that a child, an adolescent, an adult, that they have had adverse childhood experiences and are experiencing toxic ongoing stress, that you say something like, and yet you made it here. You're reaching out for help. Who or what has helped you cope? And build on the survival skills that are already there and instill hope for the future, that they will be able to cope more effectively.
Along that line, along the way in educating myself about ACEs, I had the occasion of being exposed to the documentary Paper Tigers. And Paper Tiger, one of the main points in that is when the teachers are dealing with the kids, who might be acting up, and rather than saying, "Why are you doing that?" Instead, say, "What's happened to you?"
What's happened to you?
Yeah, whole different approach.
It is.
And it kind of relates to the
Right.
demonstrating hope, or to asking them
Absolutely.
about hope.
Absolutely.
Yeah.
And conveying, that you deeply care. And to start that conversation about what has happened to you, and yet how have you come this far?
Right.
And let's look at that at the same time.
Yeah. Now, pediatricians and other primary care providers, my experience is that they don't know much about ACEs. And so what is the role? On the surface, people may not think, well, what does a doctor have to do with that? Okay. Why is it so important for primary care physicians to actually have a good understanding of this and try to do something about it?
Right. Because of the lifelong health implications. Toxic stress means toxic stress on your brain and body. And there are actual physical changes in the brain that ACEs and other sorts of toxic stress have like an indelible footprint on the brain and change how it responds. And it's cumulative. So if you have had ACEs as a child and then perhaps you're living in a toxic stress environment and maybe also have experienced, war or refugee status, those build. If we can screen for both ACEs and resilience, we can head on a different path toward wellness. If we treat a child for what we think on the surface is ADHD, and yet they are experiencing child maltreatment, they live in a toxic environment, it doesn't matter what kind of medications we give.
Yeah, it's like a Band-Aid on it.
It's a Band-Aid only. And so, and we know about the high risk for chronic diseases. For instance, diabetes. Type 2 diabetes is happening in children younger and younger.
Is that right?
And there is a connection between these types of chronic illness and adverse childhood experiences.
Yeah. Well, if people who are tuning in get nothing else out of this show, the last point that you made, I think, is really critical. That on the surface, we don't think about that kind of a connection between trauma and the physical manifestations
Yes.
of it that could be lifelong. So why should mental health professionals be concerned about this?
Because I like to say that mental health, physical health, primary care should not be delivered in silos. It's all health, and it's so inextricably linked, and people need to partner.
Okay. We're going to come back and delve a little bit more into that point because it's so important, but we need to take a break for commercial right now. You've been watching For the Health of It, and we have the great pleasure today of talking with Dr. Nadine Bean about ACEs, Adverse Childhood Experiences. We're going to have more from Dr. Bean in just a minute, so stay with us. We'll be right back after commercial. Hi, welcome back to For the Health of It. I'm Lou Beccaria. For those of you who are just tuning in, we are talking today about the topic of ACEs, Adverse Childhood Experiences, and our expert to talk with us about this is Dr. Nadine Bean from the Westchester University's master's program in social work, and who is also a clinical social worker. So let's delve into how do you screen for ACEs? How does a doctor, how does anyone, a teacher, anybody screen for ACEs, Dr. Bean?
Right. The original tool, screening tool, is just a set of 10 questions and about various adverse childhood experiences, as I had delineated before: child maltreatment of any sort, family violence, neighborhood violence, and so forth. Dr. Nadine Burke-Harris has developed a new set of tools called PEARLS, and they are ACEs screening tools for the child, for the parent or caregiver to fill out, and or for the adolescent to fill out by themselves. And these include a more expanded view of what are adverse childhood experiences / toxic stress, such as food insecurity, poverty, gun violence in the neighborhood, etc., drug trafficking. And along with that, she advocates, and I advocate very strongly, for also screening for resilience at the same time.
Okay.
It's a short screening tool as well. You can find it on the website of ACES Too High. You can find both the tools. And this is a short survey about people's coping skills and where they may be doing really well. And in the resilience screening tool, the higher the score, the better, and so forth. What you want to see is a resilient individual does not mean they have not experienced any adverse childhood experiences or toxic stress in their life. It means the relative balance of risk and protective factors in the individual, the family, and the community. And if the balance is toward protective factors, like did you have a caring adult or mentor, growing up? Do you have a support system that you can turn to, friends, and so forth? Perhaps do you have faith, traditions? That if the balance is in that favor, we're doing well, and we can help make sure that balance goes up.
It's almost like a mental image of a seesaw.
It is.
That, if you have this balance in life, because everybody, from what I'm getting from what you're saying, is everybody's had some type of trauma or stress in their life.
Yes.
But if that's counterbalanced by elements of protective factors or elements of resilience,
yes,
then it creates a balance. And I guess what we're trying to do is just have balance in life.
Yes, yes. Or tip the balance toward protective factors and thus resilience. Yeah.
Now, let me ask you this question. It's a little bit of a current events type thing. It seemed to me, as a private citizen, that a lot of the terrorism that we've seen and school shootings and things of that nature, that ACES was at work there.
Probably, or mental health issues, and then unfortunately the availability to firearms. But you're right, and every time I hear about or read about these tragic incidences, I think, what has happened to that person earlier in life? Yeah.
So, what can be done to build resilience? How can somebody who may not by nature be a resilient type person, be maybe weak, have a weaker personality, how can they build that resilience to be a stronger person?
Well, first we need to work to mitigate the impact of trauma, toxic stress. And there are evidence-based practices that can help. One is called trauma-focused cognitive behavioral therapy. It's been researched for decades now and is very effective in helping children and their primary caregiver learn how to not only to cope with, not erase the memories of trauma. That's impossible. But perhaps help build new coping pathways and problem-solving abilities. And we have seen through functional MRI studies that things like also EMDR, eye movement desensitization restructuring, actually there are changes in the primitive brain as a result of these studies. So these evidence-based practices do seem to both mitigate the impact of the trauma and help to build resilience and positive coping strategies and problem solving.
What are some of the 2 or 3 practical things that our viewers could do in their everyday life to build more resilience?
That's a good question. Please connect with others. The biggest risk factor for child maltreatment actually is social isolation of the familial unit. The biggest protective factor is social connection.
Okay.
So if you have a tendency to isolate, try to reach out, even if it's just to one person.
Yeah. It's always good to at least have one person that you can rely on as a support or somebody to go to and
Absolutely.
just to listen.
Absolutely.
Not even to solve your problem, but just to listen.
Just to listen. Of course, school counselors are really critical. School social workers and counselors in collaborating in care with primary care providers. I'm a big proponent of what's called integrated care, and that is behavioral health services integrated with primary care services and delivered collaboratively. So there's what I call the warm handoff from the primary care physician or practitioner who may be overwhelmed after screening for ACEs and can say, you know, I think you'd benefit from talking to our counselor or our social worker, and let me introduce you to her or to him or them, and that warm handoff.
Well, that sounds like great advice, and I think we'll have to leave it there because we're out of time, but this has been fascinating, Dr. Bean. Thank you very much for enlightening the people of Greater Phoenixville area on what ACES is and what resilience is. And thanks for the tips at the end about how to build it.
Thank you.
Appreciate your being here.
Thank you.
Okay. Well, that'll about wrap it up for us today, folks, on For the Health of It. We appreciate your being with us, and we hope that our mission has been accomplished in helping you be more aware of what ACES is all about, and about trauma and about resilience, and what the long-term effects and lifetime effects can be on children who have experienced various kinds of trauma in their life. Till we meet again on For the Health of It, remember, folks, if you're healthy, you're wealthy. I'm Lou Beccaria. We'll see you next time. So long, everybody.